just families in general, whatever that may look like. And to improve health, MCH works mostly through local public health agencies such as San Juan Basin Public Health. And then HCP is a program under MCH. It's specially for children and youth with special health care needs. And we can connect families to resources, provide care coordination, and improve access to pediatric specialty care. And then as the care coordinator, the kinds of things that I can work with families, meet and assess their needs and prioritize the things that they think are important. And this can include connecting to services and support such as therapies, PT, OT, speech therapy, or specialized behavioral therapies, helping parents become caregivers and working with organizations that do that, helping families access care. As you may know, there's a lack of pediatric specialists in the area, so a lot of families have to travel to Denver, or we do have some outreach clinics where the physicians come from Children's Hospital and do outreach down in Durango. So just helping families know about those resources. And then we do have financial assistance if they need to travel to Denver. Help communicate across the child's care team. A lot of these kids have multiple agencies and providers involved in their care. This can include specialty providers out of the area, schools, their primary care providers, just making sure everyone and the families are aware of what everyone else is doing. And then also connect families to programs and resources in our communities. And this can include things like food, housing, financial assistance, recreation, and things like that. And who does HCP serve? So we serve children and youth from the age of birth to 21. And it can be kids who either have or are just at risk of having physical, developmental, emotional, or behavioral conditions. And that's kind of, special needs is loosely defined as kids who need maybe extra support or medical interventions higher than what's typical for that age. And then San Juan Basin Public Health, our program serves, in our contract, it's La Plata and Archuleta counties, but because some of the smaller counties around us like Montezuma and San Juan County don't have the funding to do full care coordination, if I get calls or referrals from those areas, I can certainly help as well. And then where do referrals come from? A lot come from our community partners, other agencies that work with these kids, and then from providers, often from the doctor's office. I also get a lot of internal referrals from our other departments that work with children, including WIC, Safe Care, and Nurse Family Partnership. And then parents, caregivers, neighbors, schools can call me directly as well. And to make a referral, someone can just call me. It's pretty informal. Call me, email a secure email to communitycareteam@sanjuanbasinpublichealth.org or send a fax. And Wonderful. That's all I have. Thank you.
Thank you so much, Karen. We appreciate it. Again, if you have any questions for Karen, you can drop those into the chat or the Q&A at any time, and we will be answering those at the end of the presentation today. Next, we will be hearing from Emma Tomlinson with the Health Insurance Literacy Program.
Thanks, Katie. So my name is Emma Tomlinson. I'm the lead health coverage guide in our Health Insurance Literacy Program. Alongside me, who you just heard from, is Karen Maletich, our other health coverage guide. And our Health Insurance Literacy Program is part of the Community Health Division. One more slide, please. So the Health Insurance Literacy helps community members find affordable health insurance and understand their coverage with those programs that we use. We currently serve Archuleta, La Plata, and San Juan counties. The programs that we use include Connect for Health Colorado, Colorado Connect, and Health First Colorado. So first we'll talk about Connect for Health Colorado. This is where residents of Colorado can receive tax credits to help lower their monthly premiums and shop for health insurance on the marketplace. One more, please. Those who are eligible for Connect for Health Colorado includes residents of Colorado. You have to be legally present, filed taxes, and if you are married, you have to file those taxes jointly, and you cannot be eligible for Medicare or Medicaid. The time to apply on Connect for Health Colorado is during open enrollment, which is November 1st through January 15th of every year. Most recently during tax time enrollment. So while you're filing your taxes, you can actually select a box that says that you're interested in tax credits and shopping on the Connect for Health Colorado marketplace. That one just ended on the 15th of April. So you do have to file your taxes by April 15th. Or you can apply during a special enrollment period, such as a life-changing event, marriage, birth, divorce, or adoption does apply, or even losing your coverage from employer coverage or Medicaid. You have to apply within 60 days of a life-changing event. So that can be prior to it happening or after it happening. Next, we'll talk about Colorado Connect. So this is the platform, kind of a sister platform of Connect for Health Colorado, that is available to those who are not eligible to receive tax credits on Connect for Health Colorado. So those who are eligible, again, are those who cannot receive tax credits. So for example, if you are a Colorado resident who is undocumented, you can go ahead and shop on Colorado Connect. You can also apply for the OmniSalud program, which is where you can receive a subsidy to pay for your monthly premiums. Unfortunately, the 10,000 subsidies have been filled for 2023. To apply on Colorado Connect, it has to be during open enrollment, which is November 1st through January 15th, or during a special enrollment period, otherwise known as a life-changing event. So similarly to Connect for Health Colorado, you have to apply within 60 days of that happening. Next is what a lot of people are familiar with, Health First Colorado, otherwise known as Colorado Medicaid. In order to be eligible for Medicaid, you have to be a citizen or legally present. You have to be a resident of Colorado. You cannot be eligible for Medicare, and you have to meet the income guidelines. There are no enrollment periods for Health First Colorado. You can apply anytime. So if you apply today and are denied, you can reapply tomorrow. These are the new household income limits for Medicaid. This just changed on April 1st. It changes April 1st of every single year. So I just wanted to give everyone an update. So for an example, a household size of 3, you can make up to $2,755 and be eligible for Medicaid. So updates in the Connect for Health Colorado world, there's the end of the family glitch. There are undocumented opportunities to apply for health insurance on Colorado Connect. And unfortunately, Bright Health did leave Colorado, but there will be a new provider that will be coming on for 2024. Colorado Connect, just a reminder, there are no subsidies available for 2023, but you can reapply during open enrollment for the year 2024. Most importantly is with Medicaid is preparing for, it is the end of continuous Medicaid at this time. So those who were on Medicaid during the public health emergency, you were considered locked in. So even if you became ineligible, for example, if you did not meet the income requirements, they kept you on Medicaid. We are actively working with community members and community partners to get the word out that those who are on Medicaid at this time needs to pay attention to communications from Medicaid and that we are here to help. Here's our contact information. Our referral process at this time is you can contact us as a partner, or you can have your patient, client, or customer call us directly, and we can help them in any way that we can. Thanks, Katie, and thanks for attending.
Thanks, Emma. Lots of great information there. So if you have any questions about our health insurance program for yourself or a client, be sure to drop those into the chat. Next up, we have Jenny Howell with our Women, Infants, and Children program.
Hi, as Katie said, my name is Jenny Howell, and I am the program manager for the WIC program, the Women, Infants, and Children. I am going to go over the benefits of being on WIC, eligibility requirements, as well as how to enroll. I'd like to introduce my team. So that's me, Jenny Howell. I am a registered dietitian, nutritionist, as well as a certified lactation counselor. And working with me are Inez Labato Winter and Raylene Charlie, both WIC educators and certified lactation counselors. Inez is bilingual in Spanish and works with all of our Spanish families. Raylene is also an Indigenous lactation counselor. And Kalisha Crossland is the division director in the division that we work within, which is the community health programs. So WIC is formally known as the Special Supplemental Program for Women, Infants, and Children. Our goal is to improve health outcomes for moms and young children and to improve food security. We do this through 4 main pillars of our program depicted on this slide. The first is nutrition counseling and nutrition education. Second, healthy foods to supplement the family's diet, breastfeeding, education and support, and referrals to other health providers or community resources. So specifically, who is eligible to receive WIC services is pregnant women, breastfeeding women up to their child's first birthday, postpartum women who are not breastfeeding up to 6 months after birth, infants and children up to their 5th birthday. All of the services, I should say, are free for all the participants. WIC is for all kinds of families. Dads are encouraged to enroll their children in the WIC program if they're a single dad. Same thing for custodial grandparents or foster children are automatically eligible for WIC as well. We do not require our participants to be documented or here legally. So undocumented families that meet our qualifications are welcome to participate as well. There is eligibility requirements. So the first is the category, which I mentioned. It's pregnant, postpartum, infants, and kiddos up to 5. WIC is a program for families of limited income, and I'm going to get into that in more detail here in a minute. And then to participate in the Colorado WIC program, they have to show that they live in the state of Colorado. For income eligibility, there's 2 different ways of participating. I don't know where the content is on that slide. But the income, there we go. Families can be automatically qualified for WIC if they're on one of these 4 programs. So Health First Colorado, Medicaid, food assistance, temporary assistance for needy families is cash assistance, or the food distribution program on Indian reservations, which we have one of those in Ignacio. So if a family is currently on one of those programs, they automatically qualify for the income portion of our criteria. Next slide. Families can also qualify based on income if they're not on one of those 4 programs. they can be eligible based on their income. Our income cutoff is 185% of the US poverty level, which is a higher cutoff than, let's say, for Medicaid. So families can be over income for Medicaid and still qualify for WIC. For example, a family of 4 can be making up to, this slide shows $988 a week, which is the same as what, $4,279 a month. So if you remember Emma's slide, the cutoff for a family of 4 was a little bit lower. So families can, I think of WIC as being a program for low to mid-income families. WIC and SNAP are 2 food programs, both with an acronym, sometimes get confused. It's important to know that families, if they qualify for both programs, they can be on both programs at the same time. They complement each other. WIC is more specific in the types of foods and for, you know, that certain population, whereas SNAP is more for all ages and genders and more food choices. WIC has been around for over 40 years. It's an evidence-based program proven to improve health outcomes such as reducing premature birth, reducing low birth weight births, reducing anemia, increasing breastfeeding rates, and many more. And we meet with our families to empower them, giving them the information and the tools they need to help raise a healthy family. It's also been proven to be cost effective. Food benefits, I think WIC is well known for the benefits. Our families do get a debit card loaded with specific healthy foods that they can purchase at our area grocery stores. On average, it's about $100 per participant per month of value of the foods. That it does not include infant formula. So if they're also receiving infant formula, that value is considerably higher. We recently added a bunch of new foods on our food program on March 1st, expanded the list considerably, and that happens periodically. So now there's many more organic and many other options. So we get excited about those expansions. Nutrition education is a big part of the program. We do meet with our families every 3 months to check in, provide any education and one-on-one counseling tailored to meet the issues that they're working on in their own eating or feeding their children, and connect them with other supporting agencies that could be helpful to them. We are doing all of our appointments by phone right now. That has been the case since the beginning of the pandemic and has continued, and that has made our clients happy because it's just easier than ever to be on WIC right now. Breastfeeding support is another big component. All the staff are trained in breastfeeding, and we provide education both prenatally and support postnatally. And breast pumps are issued free of charge, and infant formula as well as needed, as I mentioned before. To connect families to WIC, somebody can self-enroll or be referred by a partner using our Colorado WIC sign-up, input of their name and contact information, which triggers a referral, and we then reach out to that person to go over eligibility and schedule their initial enrollment appointment. Families, of course, can also call our offices in Pagosa Springs or in Durango. We have a direct line for Spanish speakers, and we do also serve San Juan County in addition to Archuleta and La Plata County. So in summary, at San Juan Basin Health WIC, we believe that all pregnant moms, infants, and children deserve nutritious food. We also believe that moms and dads strive to provide the best for themselves and their children, and sometimes need a little help along the way. Thank you.
Thank you so much, Jenny. Appreciate all that great information. Again, questions for Jenny can be dropped in the chat, and we will address those at the end. Next up, we have Danette Jackson with our Nurse Family Partnership.
Good afternoon. I am Danette Jackson, and I am Program Manager and Nurse Home Visitor for Nurse Family Partnership. Nurse Family Partnership serves first-time moms and families starting in pregnancy and can continue until the child turns 2 years old. We can enroll during pregnancy and until the infant is 1 month old. We are strength-based and relationship-based. We are a home visitation program, but we can meet clients in other locations if that feels more comfortable. And we can also do some telehealth visits as well to kind of better meet clients' their schedules and their needs. So why Nurse Family Partnership? We have specially trained bachelor's prepared nurses who are trained in the NFP model. This program is based on over 40 years of research. It's evidence-based. It's intensive. It starts in pregnancy and can continue until age 2. So it's 2 to 2.5 years where the client gets to meet with their nurse about 2 times a month. It could be a little bit more than that or a little bit less than that based on needs and wishes and schedules. And it's timely, the time starting from early pregnancy until the child turns 2 years old is really an important time for family bonding, for the health of mom and baby, as well as for baby's growth and development. So to be eligible, a client needs to be pregnant with their first child or have a first child that is younger than 1 month old, meeting income eligibility. So if a client is already on WIC or Medicaid, they qualify for Nurse Family Partnership, but they can be above income and still qualify. Meet some education eligibility requirements as well as living in Archuleta, La Plata, and San Juan counties in Colorado. So NFP has 3 main goals. One is to improve pregnancy outcomes. So the nurse can provide information and resources related to health during pregnancy. It could be nutrition, exercise, maybe lowering stress or dealing with depression, anxiety, preparing for labor and delivery, for example. Another goal is to improve child health and development. So we have assessments to see how the child is growing and developing. We can provide activities to do with the child. We can talk about baby proofing. We can also talk about what to expect as the child grows, such as changes in sleep or dealing with toddler behavior. And then a third goal is to improve economic self-sufficiency. So if a client or mom is wanting to go back to school or work after baby is born, we can provide support and information to help with that process. Or if client is interested in staying home with baby after baby's born, then, does the client have the support in family and friends and to be able to do that? So how do we do this? Our NFP moms receive care, information, and support from nurses specially trained in pregnancy, early development, and the unique NFP proven model of nursing care. So this is an example of one of our brochures. A lot's going to change, but you've got this with a free personal nurse who can give you the advice, support, and information you need as a new mom pregnant with your first baby. And potential clients can reach out to us or community partners can reach out to us by calling us, texting us, or going on the San Juan Basin Public Health website. There's an NFP area, and then there's a contact form that can be filled out, and we can reach out to potential clients that way as well. So this is a quote from one of our graduates. The confidence I gained with working with NFP is immeasurable. The support and guidance offered through this program was so useful and helpful for my child and me. I would absolutely recommend this program to all first-time mothers. This is our great NFP team. Sandra is our admin assistant. Michelle and Jen are our nurse home visitors, and myself. And at NFP, we believe that better worlds start with great families, and great families start with us. Thank you so much.
Thank you, Danette. I'm going to just keep plugging that you can drop any questions into the chat, just in case we have any folks joining us late. But that was a lot of great information. Thank you. Next up, we have Tiffany Roberts. She will be presenting for our Regional Oral Health Specialist Program, as well as our clinic.
Thanks, Katie. Hi, my name is Tiffany. I'm the clinic manager here at San Juan Basin Public Health, and my first presentation will be on the Regional Oral Health Program, or as we lovingly call it, the ROHS Program. Next slide, thanks. So it consists of myself, Courtney Justice, our Regional Oral Health Specialist, who's also a registered dental hygienist, and Kalisha Crossland, our Division Director. So to start, I'll talk a little bit just about what the ROHS program is. So this is a program that's funded by Colorado Department of Public Health and Environment, and we serve 5 counties. So that includes La Plata, Archuleta, Montezuma, San Juan, and Dolores. We provide local support on oral health policy development and access to dental care at a community level, and really focus on vulnerable, underserved populations. And our program also provides regional community coalition work and care coordination for dental services. So why do oral health and public health go hand in hand? First of all, tooth decay is the most chronic disease of childhood and adolescence, and it also affects adults, with 9 out of every 10 adults over the age of 20 having some degree of tooth decay. And this is really a completely preventable problem, so that's what this program is really focusing on. Poor oral health is linked with a lot of different chronic conditions like heart disease, diabetes, dementia, pneumonia, and malnutrition, just to name a few. It can affect behavioral health like self-esteem, which can affect a person's ability to get a job or socialize. And socioeconomic factors come into play as well. When people have oral health issues, they have to take time off work. They might have transportation barriers. There might be a shortage of providers in the area. And cost can be a barrier if someone doesn't have high quality oral health or dental insurance. So we address this in a lot of different ways, and perhaps one of the biggest components of our programming is our school-based sealant program. And this is when we actually bring the dental office to schools in our area, and we can provide cleanings, fluoride treatment, screenings, and sealant. And these services can greatly reduce the risk of decay for children and can provide long-lasting protection to the tooth enamel. Sealants are placed on the biting surface of the tooth in the pits and fissures because this is where many kids get cavities. Sealants alone can reduce cavities by up to 80%, and then fluoride varnish can reduce cavities by 33%. So these are some really effective interventions to help improve oral health care in children. We also do dental navigation because we know the insurance world and dental world can be overwhelming. So our program helps community members navigate the complex healthcare system. We can help refer them to providers, resources, financial support. We can help navigate dental benefits, advocate on the patient's behalf, and assist those with complex oral health care needs. We also facilitate the Regional Oral Health Coalition, and this is a group of dental experts, organizations, businesses, interested citizens that work for a catalyst to improve oral health in our community. So we really focus on identifying and responding to gaps in services. And some of the things we're looking at now is reducing the impact of transportation barriers on oral health outcomes, increasing understanding of Medicaid-associated dental benefits so people can really maximize their insurance. And we're planning on rolling out a Mythbusters social media campaign to reduce common misconceptions about oral health care in our community. And last but not least, we have a new program we're piloting in collaboration with Delta Dental of Colorado, and this is called our Tele-Oral Health Program. So with this, we'll serve pregnant women and children aged 0 to 6, and patients can meet with us in the comfort of their own home, and our dental hygienist and regional oral health specialist will provide consultation, diagnosis, and patient education so she can help do risk assessments, screening for oral health issues, preventative education, and then refer to a dental home to really engage someone in long-term good oral health care and support. So stay tuned. We're starting this with programs you've heard today, like Women, Infant, Children, and Nurse Family Partnership, but this will be available to the public soon. So if you have any questions or concerns, please feel free to contact Courtney. She's our regional oral health specialist, and her contact information is on this slide here. As Katie mentioned, I will also be presenting on our clinic today. So this includes our sexual health clinic, immunization clinics, and I will touch a little bit on our cancer prevention and early detection program, but you'll hear more about that from Francilia, who's also on the call today. So to start off with immunizations, we provide routine immunizations for children and adults. We can serve people who are uninsured through programs like Vaccines for Children or 317 for uninsured adults. We, of course, can charge people's private insurance, so people are welcome to come in if they're insured and we can bill their insurance for vaccines. We're one of the only sites in the area that does international travel vaccines. So this is a really special program where people who are traveling can meet with a registered nurse and they'll look at demographic factors, travel factors, where are they going? What are the risk factors? What are some components of their trip that might inform what vaccines they need? Our nurse then provides an informed recommendation for what vaccines those people might need to keep safe during their travels, and then we can provide the majority of those here on site. And then as part of public health, we're always monitoring and responding to public health trends, so we can provide COVID, flu, and monkeypox vaccinations as well. Our sexual health clinic covers a very broad scope, so we can do things like screening and treatment for sexually transmitted infections. Right now, we are seeing a very significant increase in syphilis rates in our area, including congenital syphilis, which is when a pregnant person is infected with syphilis. So we do a lot of work in outbreaks like this to help educate community, educate providers about testing and treatment recommendations. We provide treatment and education, but we can also help support other local providers in the area who might be getting questions or might need more information. We can treat other sexually transmitted infections or STIs like chlamydia, gonorrhea, as well as infections that are not sexually transmitted but still pertain to sexual health, like bacterial vaginosis or yeast infections, for example. We also help prescribe, monitor, treat, and watch the health of people who are eligible for pre-exposure prophylaxis, which is also known as PrEP. This is a one-time-a-day pill that can prevent HIV infection at people that are at increased risk for HIV acquisition. And so we provide the prescription, we can provide the medication on site, we can provide financial assistance to help with the medication, and then follow labs over time as people take that medication. We support well women exams. Again, Francilia will chat a lot more about what this will look like, but it can be PAPs, Pap smears, clinical breast exams, referral for mammograms or other diagnostic things that apply to women's health, pregnancy testing and counseling. We offer emergency contraception. And as part of our opioid risk reduction programming, we can also provide Narcan to prevent opioid overdose and fentanyl test strips to clients that are eligible within our clinic setting. A lot of what we do is also outreach. So we're in the clinic, we're busy in the clinic, but we're also out in the community. We really want to raise awareness about sexual health and education, empower people to have healthy, safe sex lives. We connect people to a variety of resources. We can conduct off-site HIV and hepatitis C testing, hand out condoms and other safe sex supplies, and again, Narcan and fentanyl test strips as well. Everything we're doing is really coming from the point of serving the community, decreasing barriers to care, and increasing access to preventable services and with the purpose of improving the health of our community. This we've talked about a lot today, but the purposes of our programs, of everything we do here at San Juan Basin Public Health, is to improve access to care. In these programs specifically, we're trying to reduce the rates of STI and HIV, as well as the health impact associated with those, help prevent cancer, and in cases where we can't do that, provide early detection of breast and cervical cancer to improve long-term health outcomes, and to reduce the incidence of vaccine preventable diseases in our area. So thank you so much for your time today. Again, my name is Tiffany, I'm a clinic manager. If you have any questions or concerns, please feel free to reach out.
Thank you so much, Tiffany. If you have any questions regarding the ROHS program or the clinic, go ahead and drop those into the chat. I will note for all of our participants today that I will be emailing out slides and contact information following today's presentation. So keep an eye out for that. Next up, we have Francilia Pena with our breast and cervical cancer education and outreach.
Thank you, Katie. Good afternoon, everybody. My name is Francilia, and I am the outreach coordinator for the Cancer Prevention and Early Detection Program. And I'm going to give a quick overview of my program and what we have to offer to the community. Well, I cannot emphasize enough to my clients how important it is, have their annual checked every year, because I'm myself a cancer survivor. And the reason why I'm on the 3rd year of remission feeling great is because I detected in the early stage. So it's important to pay attention to signs and search for resources that can help you to get your annual every year. Next. I probably say that I serve the underserved and the forgotten population. I put special attention to the Spanish speaker community and the ones that don't have any benefits such as unemployment or any government benefits. So I try to focus on those. Those are the ones that need our services most. Next. So the general recommendation guideline for PEP and mammograms can vary. I always say the primary care provider will be the ones to assess how often the patient should have a PEP or mammogram. For instance, if a PEP comes up abnormal, the primary care provider might recommend that the patient to have one every year, and if not, 3 to 5 years. Same apply to mammogram screenings. So if there is a history of a breast cancer in the family, such as a mother, sister, grandmother, the primary care provider might recommend before 40 years of age. And if not, 2 to 3 years after age 40 and annually after 50. Next, please. So our program offers gas card tax vouchers to help the patients to get to their appointment. I speak up a little bit of Spanish so I can mediate when it comes to scheduling appointments, so that helps with some, overcome some barriers. However, in some situations, when after the educational piece is done, the recommendations is made, the patient still is unable to complete their annual exam. And that is because of the financial barriers, language, insurance, transportations, appointments, scheduling, food, childcare, name it. That's when I actually count on my community partners. Organizations such as Four Corners Immigrant Resource Center, Los Compañeros, Family Center, Housing Solutions, Women Resource Center are always there to hold hands and support the members of the community to overcome those barriers. And I personally am very grateful for that. Next. So those are the guidelines for who will qualify for the program. A family of 1 up to 2,602 a month, family of 2, 3,523 a month, family of 3, 4,444 a month, and the family of 4 up to $5,365 a month. So those are the guidelines to qualify for the program. Next, please. So I can make appointments via phone, video conference. I'm back seeing clients in person. I refer clients, like I said, to different organizations that partner with us to help the community to promote public health. So this is my information. I'll put also in the chat my info. If you know anybody who might need our services, please feel free to forward my contact, the phone number or email address. Thank you so much for attending. Have a good day.
Thank you so much, Francilia. And so I'm seeing some questions come into the chat, so keep those rolling in. Next up, we have Jordan Lasik with our opioid risk reduction program.
Hey there, everybody. I'm Jordan Lasik, and I'm just here to give you some information about our opioid risk reduction program, which is just kind of starting out at San Juan Basin Public Health. And I'm also going to share a little bit of information on Naloxone, the medication that reverses opioid overdoses. So just to start out with what harm reduction is intended to reduce unwanted consequences related to drug use. such as overdose deaths or various infections. You can see in the colorful boxes above many of the services that we offer in our harm reduction program. And some of the categories include education on resources and harm reduction in general, risk reduction supplies, linkages to care. And yeah, that's kind of what we got there. Supplies include overdose prevention, like naloxone, and drug testing supplies, like fentanyl test strips. We also provide condoms, kind of get everything covered there. Safe injection and smoking tools and sterile syringes are also kind of on the horizon for our program. We're planning on kind of rolling out that aspect of the harm reduction or opioid risk reduction program in the next month or two. And we also do HIV and hepatitis C testing and can make recommendations for pre-exposure prophylaxis, which is PrEP, which is like the HIV kind of prophylaxis medication. Harm reduction is evidence-based. There are quite a few benefits, which one of which is a decrease in drug use. The populations that are accessing harm reduction programs are most often left out of community services. They could be felt like they're unseen or kind of forgotten. We're really trying to reach out to people that don't have as much resources and feel comfortable accessing a lot of the things that they would need to access. The harm reduction program serves as an access point for somebody to start engaging with a trusted person and eventually connect with a healthcare or behavioral health specialist or any other needs that they have. We make referrals to all kinds of programs if people need food, healthcare, things like that. It's also important to note that harm reduction does not cause an increase in drug use or require that person be in treatment. So just a little bit about opioid overdoses and naloxone. Opioid overdoses occur when somebody takes opioids and too many of the opioid receptors in your brain are kind of hit by the opioid, and it can slow breathing, and at some point it can stop it as well. Naloxone basically blocks the effects of opioids by kind of getting to those receptors and kicking the opioid off of it. So it kind of reverses, well, not kind of, it does, it reverses opioid overdoses and can, get people breathing again. It only works when opioids are in the system, and it's not a harmful drug. It's not really known to cause any allergic reactions or anything. So if you give it to somebody that you suspect is overdosing and they're not, it's not going to cause any issues. So a little bit about recognizing an overdose. As you can see on the slide, it's mostly kind of one of the more pronounced effects is slow or shallow breathing. They could also just be not breathing at all. Generally, pupils will be kind of pinpoint, and you might see pale or blue skin. That's just because of the lack of oxygen. Snoring or gurgling noises are common as well. And no kind of pain response. So if you do something like a sternum rub or try and shake somebody awake, they're not coming out of it. So our first recommendation, and we tell all this stuff to everybody we give naloxone to, but is to call 911 first, so that EMS can get on the way. And then you would continue trying to make the person respond. And if there's still nothing, we recommend a few rescue breaths, generally like 3, and then you can administer the naloxone. We offer a nasal spray and an injectable version, but the nasal spray is a lot more common and kind of easier to use. It takes about 2 to 3 minutes for the nasal spray to kind of take effect. So we recommend doing rescue breaths in the meantime to try and give that person as much oxygen as they can have to minimize any damaging effects of not having oxygen in your system. And if they do come to, we recommend to put people on their side. So there's no chance of, aspiration or like throwing up or anything, just problems related to that. And then just to keep the person awake and breathing, and hopefully EMS will, handle the rest. And as far as safety goes, as I mentioned earlier, naloxone won't harm somebody if they are overdosing on drugs, or even if they're not. It's a very benign drug and can be given to people of all ages, from infant to older adult. And why we carry naloxone? In nearly 40% of overdose deaths, somebody else was present. So if that person had naloxone, it could be, likely that they would have been able to reverse the overdose. And if you look at this chart, this is drug overdose deaths in La Plata County over the last 22 years, and it's been pretty steadily increasing. So a little bit of our, sorry, I went to the wrong slide. Kind of plan for the future for the opioid risk reduction program. In the next month or two, we're going to be offering more comprehensive services at MANA. We're already there 1 day a week on Fridays, kind of distributing naloxone and fentanyl test strips and providing education and referrals to resources that might be needed. But we're going to kind of start rolling out the rest of our programs, such as like syringe access, safer smoking tools, and just kind of harm reduction tools in general to help people use their drugs a little bit more safer and hopefully get them some referrals to treatment. And like I said, currently we're still providing the naloxone and fentanyl test strips at MANA. But we're just kind of in the next month or so planning on, providing more of those resources that we were talking about. So the next slide, these are our distribution dates that we have at San Juan Basin Public Health. We just had one yesterday and it was very busy, but these are the dates that we have going forward. And like I said, I'll be at MANA every Friday from 9 a.m. to 1 also if you need access to any of our services, or you can just reach out to myself or Ashley, whose contact information will be in the next couple of slides. Yeah, and there's our contact information. So if you have any questions, just feel free to, throw them in the chat or send me an email or send Ashley an email. We'd be happy to help.
Wonderful. Thank you so much, Jordan. All right. So we have one more program to present on, and then we'll be getting to the Q&A. So next up, we have Amelia with our Thriving Communities programs.
Hello, everyone. Thank you for being here today. My name is Amelia Majewski, and I am the Tobacco Prevention Coordinator / Suicide Prevention Co-Coordinator Facilitator here at San Juan Basin Public Health, and I am here with the Thriving Communities program today. Next slide, please. So the Thriving Communities program focuses on 3 programs. They focus on youth prevention surrounding substance use in La Plata County, tobacco use prevention in both Archuleta and La Plata County, and deaths by suicide in La Plata County. Next slide. And so here are the coordinators. This is the team. We have Dixie Reed, who focuses on substance use prevention and oversees the ROHS Coalition that I will speak about in the next few slides. There's myself, Amelia Majewski. I oversee the tobacco prevention work. And then we have Anna Denali, who oversees the suicide prevention work. And we lead the coordination of community efforts here in our health district. Next slide. So what is prevention? This graphic here will show you the primary foundation of prevention. As you see, it is split into 3 different types of prevention. There's tertiary at the top, which focuses on providing support and rehabilitative services to prevent deterioration and maximize the quality of life, such as rehab services for injuries like heart attacks and strokes. Secondary prevention there in the middle is where one screens for risk before it becomes an increased problem. So in our programs, that could be PHQ, which is a health questionnaire that people will receive when they go into a health clinic to see their mental health. And then primary prevention at the very bottom, which impacts the greatest number of people. And all of our programs through their Thriving Communities program focus on primary prevention through promoting trainings on how to talk with individuals on health behaviors, promoting pro-social opportunities. This could be positive and safe spaces for young people to meet and not be surrounded by substance use, sharing positive messaging with the community, So messaging that shares the positive choices young people are making and providing education and tools on how to build healthy relationships. Primary prevention can truly mean so many things all at once, and we may not even realize that it's prevention in action sometimes. Next slide, please. So substance use prevention is our first program that I will be focusing on today. It is here to promote substance use prevention with the support of a community-led coalition called Recognizing Opportunities Around Resilience, also known as ROAR for short. That's ROAR. It was established in 2018 to focus on supporting young people in our community, 12 to 24 years of age in La Plata County, all while reducing the rates of substance use with the promotion of the different pro-social opportunities, positive community messaging, all while working closely with partners and young people here in the community. You can also find them online via their social media on Instagram and Facebook at Roar La Plata. Next slide, please. And so this coalition has identified top risk factors in La Plata County that contribute to substance use. The ROAR Coalition uses the Communities Organizing for Prevention framework, also known as COFP. Many of you may have known of this framework previously as Communities That Care, or the CTC framework. And so the next slide, we utilize the 5-phase process from the slide before. So the top risk factors, so we can go forward to the next one. So that circle there was what I'm kind of referring to. But the top risk factors include community laws and norms favorable to substance use, along with favorable parental attitudes and involvement in substance use. And then we have 2 top protective factors, one of them opportunities for pro-social involvement, and then rewards for those pro-social involvement opportunities. And so the next slide about the ROAR Coalition, this one here just shares with you some pieces of where we've been seen in the community and how we show up. We work closely with the state of Colorado and our local partners to build out action connected to those risk and protective factors, really emphasizing the need for youth to lead the charge and deciding what is going to work best, along with deciding what those projects need to be here. If you know of any adults or young people that would like to get involved, we would love to have you. Otherwise, our next slide is going to move on to tobacco. So our tobacco prevention use work overlaps a lot with all 3 programs of the Thriving Communities program, since it is seen that substances are tobacco nicotine products. And so mental health is also very heavily tied in because many people do lean on to tobacco use as a coping and mental health reliever or stress reliever. We really like to promote the Second Chance program and breakdown of infractions with schools. So that's kind of where goal 1 comes into play. This is a great tool to work with students on campus with tobacco nicotine products to understand the harms, but also aid young people in deciding if they would like to quit. Then leading into goal 2, we like to focus on protecting people and the environment. So I also sit on the Tobacco Review Committee and different hazardous waste groups with other grantees across the state of Colorado. And we're all looking at different methods that work especially for our community's needs, working closely with schools and businesses in the community to promote safer hazardous waste disposal and sharing insight on how we can keep our community secondhand smoke free and hazardous waste free. While providing tobacco prevention work in any capacity, we always make sure to promote and bring awareness to all the different free cessation support available to those who have decided they want to make that leap and quit or make a change in their lives. We do have different cessation services here in Colorado, such as the Colorado Quit Line for ages 25 and up, My Life, My Quit for those 12 to 24, Keep It Sacred for the American Indigenous and American Alaska Native populations, Baby and Me Tobacco Free for the pregnant population and postpartum population. Our next slide will also talk about suicide prevention. And as we see here, shift over, the map presented here is from the Centers of Disease Control and Prevention, also known as the CDC in 2020. This map here shows the national adjusted rates of suicide. Colorado consistently ranks at the top 10 highest rates of deaths by suicide. And then going into our next slide shares how we came about with our funding. So looking at La Plata County specifically, this county had spiked rates especially in 2018. So that kind of led to a pilot project addressing deaths by suicide here in Colorado. And so the next slide will share with you the Suicide Prevention Collaborative here in La Plata County has a similar kind of idea to the ROAR Coalition, meeting with different community and stakeholders. We are really looking to improve local mental health outcomes for individuals young and old. There is, however, a different approach on how the community approaches suicide. With the next slide, it shares with you the 6 different pillars of suicide. So we focus on connectedness, economic stability and supports, education and awareness, access to safer suicide care, lethal means safety, and postvention and bereavement. And there you can find our website, lpcsuicideprevention.com. So if anyone has any questions, please feel free to reach out. We are always welcome and happy to see new faces join our groups. So thank you all.
Wonderful. Thank you so much, Amelia. All right, so I know we are getting close on time. I'm sorry for any folks who have to jump off before we got to your questions, but we will continue to record through this session. So we'll make a point to get to everyone's questions. So first, we did get a question for Karen. What does HCP stand for?
Hi, so great question with all the acronyms, and HCP, originally it was the Handicapped Children's Program. And then when that was no longer being used, they wanted to keep HCP because it had become familiar to families and organizations, but it's just the healthcare program for children and youth with special healthcare needs.
Wonderful, thank you, Karen. I see a question about emailing slides afterwards, and yes, we will email out the slides and the contact information from today. So do keep an eye out from that. I should have emails that you used whenever you signed up for Zoom for this webinar. All right, we have a question for Amelia that says, how will recent Juul litigation and settlement affect specifically La Plata County programs and services?
Yeah, so at this time, I do know that the state, so CDPHE, Colorado Department of Public Health and Environment, along with the STEPP program, since that is primarily where it is housed, they will be overseeing any of the Juul litigation settlement items at this time. It is still too soon to tell what will happen with that, but I do know that CDPHE, the STEPP program, the Tobacco Review Committee that I mentioned, along with the Board of Health, will be overseeing how this funding will be utilized in the different grantee communities across the whole entire state. So soon we will learn more. So thank you for that question.
Thank you, Amelia. Okay, I am not seeing any other questions immediately, Anne. Do you have any?
I don't see any other questions either.
Okay, great. So I do want to just turn off the recording really quickly to give people a chance to answer questions without the recording, if that is at all a barrier.